Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Twice a year, the Mayo Clinic conducts a national health checkup survey, taking the pulse of Americans on health opinions and behaviors. The most recent survey, released in October, focused on opioids. Well, what exactly are opioids? Well, they're a class of drugs that includes the illegal drug heroin, synthetic opioids like fentanyl, and pain relievers that are available legally by prescription, like oxycodone, hydrocodone, codeine, morphine, and several others.
That's a long list.
It is. There's a lot of them out there.
Unfortunately, a record-breaking 72,000 Americans died from drug overdoses in 2017. That's according to preliminary estimates from the Centers for Disease Control and Prevention. Most of those deaths were related to opioids. So what do Americans know and think about the opioid crisis? Here to discuss is the chair of Mayo Clinic's Opioid Stewardship Program, Dr. Halena Gazelka. Welcome back to the program. It's great to see you, Dr. Gazelka.
Thank you so much for having me.
Thank you, Dr. Gazelka, for being here. You know, it's interesting that Mayo Clinic's National Health Checkup this year just focused on one important topic, opioids.
Yeah, and what a big topic.
Yes.
That's all you see when you turn on the TV or open the newspaper. There's just article after article about opioids and their impact on the United States. And I think it's really interesting that we did this survey now, because I think that most Americans do understand that this is a major national crisis, not just in healthcare, but a societal crisis. And it's really important for patients to participate in their own health care and to be able to talk to their providers about opioid-related issues.
How did this whole thing get out of hand? Isn't it true that a decade or so ago, physicians were criticized because they weren't prescribing enough pain medication? Their patients were in pain and they were ignoring it? Is that how it all started, or how did we get to where we are?
Well, that would be a simplistic view, I think, but it's such a multifaceted problem. I do think that providers need to own the responsibility that we have had in contributing to the crisis. At Mayo Clinic and our Opioid Stewardship Program, we have really focused our efforts on managing the supply of these very important medications. And I think there are so many other aspects of this crisis that need to be addressed by the government, by other agencies, but we need to do what we can do as providers, and patients need to do what they can do as patients to prevent and to help to fix this crisis.
It's interesting to me that one of the things that has changed is even just the mindset from we need to remove pain from a patient's life to we need to manage pain for a patient's life. And what's the difference in those two sentences?
Well, I think we've created a culture of expectations that if I hurt, I shouldn't hurt. And that if I hurt, surely there must be a fix for that. I could take a pill for that. Someone should be able to fix that for me. I don't think that's necessarily true in other industrialized countries. We use far, far, far more opioids than any other country does. And I don't think it's necessarily because we're treating pain better. I think that, what was it you asked me again?
The difference between removing pain from someone's life and managing pain for a patient.
Right. I think that removing pain is a worthy goal. Wonderful if we can do that. Acute pain is like that. Often patients come in, they have an injury, they've had a surgery, they have some reason that they have an issue with pain, but we know it's going to get better, or we presume it's going to get better. The problem is that there is a lot of chronic pain that patients either deal with for years or for a lifetime. And it's those patients whose expectations must be that we will help you to manage your pain. We will find a way to deal with that. I see these patients all the time in the pain clinic, but opioids are not necessarily the answer, nor is fixing your pain.
Don't you think it's hard to argue that the providers aren't in some way responsible for this crisis? Because somebody had to prescribe these medications. And did we not understand how addictive opioids really are? Or are people getting these kind of medications someplace else, on the internet or someplace?
That's a really good question. And I think, unfortunately, it is true that we didn't know how addictive these medications are, and that they were sold by drug companies as not being addictive. We were told not to be concerned about that as providers, but it wasn't true. I remember when I was in medical school that one of my professors told me that 50% of what you learn in medical school will be disproved during your medical career.
Really?
So
50%?
So keep learning. I don't know whether that's true.
I know I've forgotten 50%.
But I've I've seen a lot of major changes in how we manage patients since graduating from medical school. I do think the medical community has an incredible responsibility in this. When we make recommendations to our patients, they assume that we are making the right recommendation. They assume that we have knowledge behind what we're doing, that we're practicing evidence-based medicine, and that we're giving them the best advice there is. So if we neglect our responsibility to share with patients the clear disadvantages of these medications and risks of them, I think today, however, that patients also have a responsibility. We live in a time of incredible education and availability of knowledge. And while it is the responsibility of providers to explain to patients what mechanisms may be used to treat their pain and to warn them about the possible side effects and risks of medications that are prescribed, I think that patients should feel empowered to ask those questions of their providers as well.
Yeah, I think you're absolutely right. And that discussion needs to happen. And I don't think we probably had the discussion we should have had with our patients over the past many years. We gave them too many pills, and we didn't tell them how addictive they were, and maybe we didn't understand that either. And we probably should have said these are for acute pain. These are for short-term use. Mm-hmm. If you need to keep taking them or think you need to keep taking them after 5 days or a week or whatever, you need to come back and see me. Sound
I agree
reasonable?
with that, and that's kind of what we are trying to promote now. We have worked quite a bit on our prescribing practices here at Mayo. You're right. We were over-prescribing. We were giving out too many pills and people weren't using them. And then what do they do with them? They keep them in their medicine cabinet. That puts others at risk of misuse. It puts our communities at risk of diversion and pills being floating around for our school children and others to get a hold of.
You mentioned that there are all of these pills sitting around that people didn't use, which is partly a good thing, but they don't know how to get rid of them, and they leave them around. I have heard these figures about how many oxycodone tablets are sitting around the city of Rochester. I mean, it's mind-boggling. So what are we supposed to do with the ones we haven't used and don't need?
Well, that is correct. I think that patients don't have enough information about disposal, and I think one reason it's so confusing is that different websites say different things, and that different communities have different resources available. So many communities have a box available either in the sheriff's department or in the police department where patients can drop off their pills. We are working on getting those boxes here at some of our pharmacies at the Mayo Clinic. And we are participating in the DEA National Take Back Day for medications.
Yeah, that's held a couple of times a year, one in the spring and one in the fall.
That's right. There's one held typically in April and one in October, and it's a great way for patients to get rid of their medications.
And how do you find out when those days are in your city?
Patients can look at the DEA website, takeback.dea.gov.
Takeback.dea.gov.
Correct. And they can see when those events are being held and whether there might be a location near them where they could dispose of their medications.
All right. And why is it wrong to flush them?
Well, it depends who you ask. The FDA website actually says it's okay to flush medications.
Oh, all right.
I think it depends how many medications you're trying to get rid of. If you've got a couple pills left in a prescription of oxycodone and you need to be rid of it in some way, I think it might be okay to flush those pills. However, the EPA would probably tell us it's not a good idea, that we're contaminating our water supply. So there are many better ways to get rid of medication. Some are bags with charcoal, and they can be pills can be added and then water added, and it destroys the medication such that it can't be reconstituted to abuse or misuse. And so there are many good ways to dispose of them other than the toilet.
If you take them to one of those sites that you have contacted the DEA about and you do it on the day for your city, what do they do with the pills?
So basically, working in conjunction with law enforcement, the pills are collected, boxed, and then destroyed in an incinerator either that same day or the next morning.
All right, we've been talking with Mayo Clinic pain medicine specialist, Dr. Halena Gazelka, about the October Mayo Clinic National Health Checkup Survey, which focused on opioids. We're going to take a short break.
When we come back, we'll dig deeper into the results of the survey and find out how Mayo Clinic is tackling the opioid problem.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
We are back talking with Mayo Clinic pain medicine specialist, Dr. Halena Gazelka, about the most recent Mayo Clinic Health Checkup survey. What do Americans know and think about opioids?
So, Dr. Gazelka, what is Mayo Clinic doing to combat the opioid epidemic? What's happening on our front?
Well, first of all, thanks for having me. I'm enjoying being here today. We have formed an opioid stewardship program here at Mayo Clinic, which I have the privilege of chairing. We've been very active since 2016 and have made some incredible strides in both understanding our opioid prescribing habits, understanding the needs of our patients, and then changing our behaviors to fit. One of our first projects was to understand what our providers are sending patients home with. So we looked at nearly 8,000 patients who had common surgeries performed at the Mayo Clinic, not just here in Rochester, but also in Florida and Arizona. And we looked to see what the patients had provided when patients went home. Then we called about 3,000 of those patients and surveyed them and asked them to look and see what they had left. How many pills did they use? How was their pain management? Asked them a number of questions. And most of them, 63% of the pills that we prescribed went unused. Mm-hmm. And most of the patients, about 89%, kept them in their medicine cabinet after they were finished for the next time someone might need them.
Wow. Yeah, 89%.
Yes, it's striking, really amazing.
I have to say that for me, whenever I have had a prescription, I am so afraid to use it because you hear about the addiction parts of it, or I end up having some left over. It's because I think I underuse them for just those short term that I need them. Is that something that people are doing too, and that's why they have some left over?
Oh, perhaps. Maybe it's sort of like having an insurance policy or carrying your umbrella. That if you have the opioids there, maybe you won't need them, but you certainly can save them for a rainy day. That's perhaps the philosophy. Based on what we found, we then developed guidelines. So they're individualized guidelines, individualized both to patients and to procedures. So part of our campaign here at Mayo has been to avoid blanket prescribing standards. So a lot of the legislation regarding opioid prescribing has centered on how many days can a provider provide to a patient. 3 to 7 is most popular. How many milligrams can they provide to a patient, and what number of pills can they provide to a patient? Now, patients are different, and procedures are different, and events are different. And so we would like to leave space for providers to use their knowledge, both of the patient and of their situation, to prescribe the right amount of opioid to them. However, with our new guidelines, we've been prescribing approximately 50% less in some of the departments that have thus far participated, and we've measured their results. And we estimate that's about 1 million pills less a year here in the city of Rochester and in our other major sites as well.
Wow.
So we've had some follow-up, and we're doing better.
That's right.
But are we there yet? I mean,
absolutely not. I wish. Don't I only wish?
Yeah.
We have many, many ongoing projects to help deal with this. I think education is a big aspect of this. We need to educate the public about what to expect. We need to educate providers on how to do this better than they're doing it right now. And we're actually developing videos and printed materials for both of those reasons.
For the physicians and the healthcare providers that work here at Mayo, is there some place that you can go and get that prescribing information and suggestions and how we should do it and how much we should be prescribing?
Absolutely. We have all of our guidelines published on Ask Mayo Expert, and we have an opioid stewardship website under O in the groups on the Mayo Clinic website.
And how about a patient? How can they learn more about this and about opioids?
One of the best places that patients can look right now is on our website, healthcheckup.mayoclinic.org, and we have lots of links and information for them there.
Healthcheckup.mayoclinic.org.
That's correct.
One of the things that I wanted to ask, I noticed from the survey results that were done for the National Health Checkup, was that Americans see opioid use as a problem, Yes, they agree with that, but they don't see themselves at risk from it. Can you expand a little bit about that? What does that mean?
Isn't that just human nature? Right. Might happen to someone else, but it probably won't happen to me. Yeah, 67% of respondents understand that substance use disorder or addiction to opioids is something that can develop, but they certainly don't think it will happen to them. And I think that's really a faulty thinking. We know that there are likely patients who are more likely to develop substance use disorders. Some of those risk factors we understand today. Many of them we do not. There are probably genetic factors involved and many other factors. But everyone should treat these medications with respect and with the genuine concern that they would not want to remain on them longer than they needed to, because that risk of abuse and addiction does increase with time.
You have said that we haven't solved this problem yet. So what next steps? What are you going to do now?
Well, we have a lot of ongoing projects. We, as I said, continue to educate our providers. We also, and our patients, we also are implementing changes. So this is a big organization, and it doesn't happen overnight. So even though we've written guidelines, we need now to disseminate them. We also are working on workflows so that prescribing the right way is easier for providers. These are conversations that take a long time. Monitoring patients on opioids is a tremendously resource, resources. It's a costly endeavor. It takes time. And we are trying to make that as simple as it can be for patients and providers. We will continue to study our prescribing practices to make sure that we're in compliance with state and federal legislation concerning opioid prescribing, and even to change our guidelines as needed if we find out that we are still don't have it right, that we're prescribing too much or too little.
Before we finish up, what are some of the other survey results that we found from that national health checkup?
I really thought this was an interesting survey. I think it's striking and something that providers need to recognize, that patients want something different. 94%, that's almost every American, 94% of the people surveyed stated if they had a choice, they would prefer not to take an opioid and instead would like their pain treated in another way. This is ripe for conversation. When patients are going in and having surgery or have some sort of an injury or need opioids, or think their provider thinks they need opioids. I can think of one good example, and that's in wisdom tooth extraction. Years and years, we were prescribing significant amounts of opioids for wisdom tooth extraction. However, there are good studies showing that a combination of nonsteroidal agents, such as ibuprofen and acetaminophen or Tylenol, are just as effective as treating that pain with opioids. We also know that individuals who come in contact with opioids before the age of 18 have a significantly higher risk of misusing or abusing or becoming addicted to them in adulthood than someone who does not experience opioids until they're in adulthood.
So interesting. My daughter had her wisdom teeth out maybe 4 or 5 years ago. 30 oxycodone, and took, I think, 3.
Oh my gosh.
So you're absolutely right. Yeah, good for you. Well, it's so good to have you with us. We want to congratulate you on all the work that we're doing. We don't want our listeners to forget about the fact that there are places that they can take these medications twice a year. Go on the DEA website and figure that out and take in all those. Hey, by the way, do they ever go stale? Do they ever lose their potency over time?
Oh, there are expiration dates on most medications. I don't think most of them are valid. They last a long time. One important point that I'd like to make is that we call our program here the Opioid Stewardship Program. I chose that name and asked it to be named that for a reason. These are really good medications. They're often appropriate medications for patients. We are not anti-opioid at the Mayo Clinic, but we just encourage the use of the right drug for the right patient at the right time, and want to convey that we understand our responsibility toward patients.
All right, I'm glad you got the job, and I like the name.
Thank
We've
you.
been talking about the Mayo Clinic National Health Checkup Survey, which focused this year on opioids, with the chair of Mayo Clinic's Opioid Stewardship Program, Dr. Halena Gazelka. Thanks for joining us, Dr. Gazelka.
Thank you so much for having me.